Hello, and thank you for joining our LinkedIn Live series, where we are continuing to explore how data and analytics are influencing a wide range of industries. My name is Jeremy Petranka, and I am the Associate Dean of the Quantitative Management Programs at Duke University's Fuqua School of Business. Our Master of Quantitative Management programs are designed to bridge the gap between more modern data science tools and the specific strategic and operational needs of businesses. Today, we get to dive into the ways that data has been changing healthcare trends in the US over the last few decades. And as this is a big topic in almost any way you look at it, I'm extremely excited to be joined by David Harvey, a Fuqua alum with a deep background in exactly this area. So currently, David is the model lead for the Centers for Medicare and Medicaid Services ACO REACH model, which stands for Realizing Equity, Access, and Community Health. Today, though, he's really going to be focusing on the 10 years before that he spent in the private sector, mostly focused on health insurance benefits. So most recently at Optum, David managed enterprise-wide market research initiatives on policy and market changes. And prior to that, he was a consultant at United Healthcare, where he actually helped health plans gain insights into their financial trends and broader population trends. So prior to earning his Master of Science of Quantitative Management and Health Analytics degree from Fuqua, David completed a bachelor's degree from George Washington University. So David, can't thank you enough for joining us today and be willing to let us pick your brain on something that has affected or is going to affect almost everyone watching this. Your experience in industry is exactly what we're hoping for.
Thanks, Dr. J. It's a pleasure to be here. I want to just do a disclaimer before we get started. Any views I express here are mine and not intended to reflect any views, policies, or positions of the Centers for Medicare, and Medicaid. And on that note, I'm looking forward to just talk about the commercial market today and diving into these insights.
Perfect. So let's actually jump in. So what I found on the use of data in healthcare, it can be really hard for patients or anyone outside of the industry to really wrap their head around what's happening. So, on one hand, anyone that's gone to a doctor in the US or any clinician in the last 10 years knows that there is an enormous amount of data being collected, whether it's the intake forms we have to fill out now, which are a lot more than they used to be, whether it's the fact that during the actual clinical setting, a lot of times my clinician is looking at their computer screen and entering things there as opposed to actually, facing me in some situations. So I know that the data is being collected. But on the other hand, and this could be me personally, I haven't really noticed a change in my experience when I go to my doctor's office. My checkups feel about the same. The recommendations are pretty much what I would expect for a 46-year-old man. And I got to be honest, I don't know that I would feel that comfortable if it suddenly did change. So with kind of all that in mind, can you give us a better idea of how data is actually being used, possibly in ways that we don't even see as patients?
Yeah, my pleasure. And so I think what you mentioned there is kind of why are we talking about data in healthcare? For starters, you kind of gave it a patient experience. The patient experience in healthcare and the commercial market leaves a lot to be desired right now, as well as for the past, for a while now, particularly the past 10 years, we've seen healthcare costs, premiums in particular, grow in the commercial market around 5% annually every year. In the next decade, we're going to expect similar 5 to 6% growth in the commercial market every year for the next decade. And so the experience leaves a lot to be desired. And of course, healthcare is very expensive right now. And so data is being used basically every solution under the sun to evaluate, to find targeted areas, to find different ways consumers interact, to improve that patient experience, to bend the cost curve, as they say. And so the only limitation right now in terms of how healthcare is being used, how data is being used in healthcare, rather, is just our imagination for all the different applications that data can help improve those experiences and bend cost.
So I think as part of that, we've heard the term value-based care be kind of a popular, in some ways, catch-all, over the last 10 to 20 years. Can you give us more of an idea of what that actually means, both for clinicians, for patients, and how data is kind of informing that?
Yeah, so that value-based care, that term gets thrown around quite a bit. I'm going to give you my simple definition. Value-based care is about paying for quality, paying for outcomes of services. This is as opposed to traditionally how the employer market, commercial market, and I use those two interchangeably, have historically reimbursed based on the volume of services, otherwise known as fee for service. Every time you go to the doctor or go to the emergency room, you get billed for that. So to better understand value-based care and how data is being applied to value-based care, let's take a couple solutions. A couple examples rather, and apply those solutions. So let's take knee surgeries, for example. So we know that folks, when they get a knee surgery, there's a whole series of services that have to be performed. We also know that readmissions or infections after the surgery was done can be quite costly and can have a huge impact on a patient's quality of life. And so value-based care is being applied here to help measure, physicians who perform better surgeries, reducing those readmissions for those patients, and leading to the best possible outcomes. That's one example of value-based care, kind of a point solution for a single service. Another example of where value-based care is very popular is for chronic care conditions. And so let's take diabetes as an example. So diabetes, if someone has diabetes, on average, they're going to cost around 20-25% more than a patient who is perfectly healthy and does not have diabetes. And so that involves a ton of management. It involves, making sure they're taking the right drugs, and all these other metrics to keep them, for example, out of the emergency room healthy, and living a great life. That all requires data. It requires data to figure out which drugs are the best to be able to use with the patient. Are there early interventions you can make before a patient becomes diabetic? As well as, how do we engage someone? What are they most likely to engage in if the insurance company provider reaches out to them? Email, text, phone call, you name it. So that's just some of the examples of how data is helping us transition out of that kind of paying for quantity in the commercial sector as opposed to paying for quality.
And so how often or how frequently are you seeing that this transition has happened, that the providers are actually now getting paid for outcomes as opposed to for procedures? Is that something that is basically industry standard now, or is it still kind of a progression that we're in the middle of?
It's still very much so a progression. It's funny because these value-based care, some of these initiatives have been around for a while now in the commercial market. But, as employers are looking at their costs and as employees, of course, are paying more out of pocket, it is beginning to trigger the discussion, are we paying for the best quality of care? And so it's definitely been adapting. What we're seeing as well right now is that a lot of health plans, insurance companies are offering health plans that are based around value. And to do that, to evaluate the doctors, to see which opportunities, what premium would someone, or rather what copayment would someone rather pay, to go to a high quality doctor as opposed to, another doctor. That's all being accounted for and brought to you by data, essentially finding those opportunities.
And this is one that I think, and my apologies, I didn't tell you I was going to go in this direction, but I think that it would probably surprise a lot of people to know what data looked like in the healthcare sphere, even in the 90s, early 2000s, as opposed to what data looks like now. So in other words, if you're thinking about, well, what works? What's the method of communication that makes sure they come back? It feels like, well, yeah, we should know those, right? Can you give an idea, though, of what data looked like before 2010, 2005?
Yeah, I have an idea, of course, because it was a little before my own time. But traditionally speaking, data's been around in healthcare for a while. How do we calculate insurance premiums? Well, we look at the demographics and the geographic factors of where folks live. We look at actuarial tables to see how much could someone cost, and we put that all together, that historical data, and that's the premium, right? From the provider perspective, how do they get paid? They coded for the number of services they provided. And so the data itself has been around for a while, but to your point, a lot of providers and insurance companies were never really asked to use this data in this fashion. And so retooling that data, setting up, analytics, dashboards, you name it, is definitely, we're in a moment of transition from when I first started, way back when in the mid 2010s. It's definitely a huge leap forward to be able to apply this data, because at the end of the day, we can talk about, advanced predictive analytics and AI and all these other things. If you can't organize that data in an easy way to be able to understand, you're not going to be able to provide those insights, look for those opportunities for savings as well to improve a patient's quality of life.
So I don't like that you call 2010s way back when. Ignoring that fact, I actually want to talk more about what you talked about, because it feels like not just having the data, but now looking at the data in this way potentially would open up a new world of population health, that we can start. I could imagine my provider could tell me, look, knowing this about your medical history, knowing this about your family history, knowing this, it is likely that this could be happening. Why don't we have an earlier intervention? Why don't we really get things that are going to be more cost effective, but better for me, because I'm not farther down the disease path by the time we start actually, treating or getting involved with something. So it feels like this is there. It feels like the analytics tools we're talking about are, at least in some ways, especially on the insurance side, being used to understand what's there. But besides some of the challenges you mentioned of just changing the paradigm and having the system look at it in a different way, I actually imagine that there would be some pushback, potentially on the actual patient side. If you tell me, well, this isn't specific to you, this is kind of a statistical thing we see. I could see some people, especially that haven't, kind of had the same healthcare their entire life. I could see there being some resistance to that. Can you talk about a little bit more about what we're seeing in terms of bringing these data and these insights, not just for the insurers and the clinicians, but to the patients, and whether we're seeing acceptance of that?
Yeah, that's a really good point. And I know one of the things we talked about in school quite a bit was that, patients, healthcare is kind of a unique industry where the patient and the doctor are not making healthcare decisions independently. You have to essentially gain the trust of a patient. Really hard to do, easy to lose, right? And so, a big part of what's happening in healthcare right now is figuring out how to interact with those patients, how to gain their trust. Doctors have a little bit easier than insurance companies because there's more of that personal touch with doctors. In the office, they can say, hey, it sounds like you have a family history of this. If they have a fancy, electronic health record system in front of them that's telling all this stuff, they would advise them right there. Insurance companies have a bit more of a barrier to that regards because, oftentimes people think, oh, the insurance company is calling me for something's wrong with a claim. And so to that exact point, there's been a big discussion the past few years on retooling the healthcare system to be more consumer friendly, more patient centered. And a big part of that is using analytics to discover what are the barriers that are preventing patients from getting care so we can find those opportunities earlier on. I'll use a quick example of the knee surgery. Let's say someone's having knee pain, very, very common, when you get it in your 40s or in your 50s. Well, if that's flagged early enough in the claim system, what could happen is that you could get an outreach from your insurance company and say, hey, we saw you're having some knee pain. Would you consider enrolling in physical therapy with us? We have a nurse clinician that'd be able to help you on your care journey. Here's an app if that's an option to you. Give them a bunch of choices to be able to choose from. Because at the end of the day, it is a big lifestyle change potentially to get that knee surgery. Every procedure has some risk in it. And so being able to influence that behavior earlier on, or alternatively, if someone's too far down the path where they really do need that knee surgery, for example, being able to provide them the best quality doctor, steer them is going to be best for the patient and for, of course, the cost element of it. All this can only happen with data.
So this, again, this is the N=1 problem of, well, as me as a patient, it feels like that I wouldn't really have resistance to. Like that actually feels like I'm getting additional support. That said, given that this is a fairly recent shift in how we think about healthcare in the U.S., are you seeing that this is being able to be adopted in kind of the ways that probably all sides of the healthcare industry would want? Are there pockets where it's really becoming more common, or is it just kind of a slow march that you've seen?
I think it is a slow march, and it does really depend on the condition. I use the example of knee surgeries, but there are other examples like chronic care conditions. We'll go diabetes. Making that intervention early on, being able to bring the right clinical tools, of course, does remain a challenge, depending on exactly what we're doing. The other thing as well is that we're talking healthcare here, and health insurance in the commercial market, the employer market. What is a particular barrier in that market that could prevent, let's say, someone from working with their insurance company or doctor? Well, 160 million Americans get their insurance through their employer or their parents' employer, their spouse's employer. If that person who has the insurance changes jobs, well, they change insurance all over again, right? And maybe they had a bad experience with their previous insurance. Maybe they're in the middle of their care journey and they need to get everything reapproved again. I think one of the barriers as well that I see the industry slowly starting to change is that we're going to get a little weedsy if you allow me here. Let's say, for example, that you have Harvey's insurance company at Duke University. And for some reason you say, I'm going to go to work at another university in North Carolina in Chapel Hill. We won't name that university, of course, 15 minutes up the road. And they also have Harvey's insurance company. Well, historically, what that meant was that you were tied, your member ID and group ID was actually tied to the other employer, even though you were a patient who went through the healthcare journey with another insurance company. What does that mean? Well, they may not have all the data, pre-approvals you got if you're having that knee surgery or going through physical therapy. They may flag their analytics as saying, hey, why is this person getting a back, physical therapy for their back? Was there a car accident? Well, we are not going to pay for that. They reach out to the patient. This, by the way, has happened. Reach out to the patient. And essentially create that sort of trust barrier. We're saying, well, I've had this issue for a while. How can you not know this? And so that is one of the examples in terms of well-meaning analytics. The analytics did their right job, but the actual human implementation of it fell a little short. And so it really is, it's going to be an interesting development in the next few years to see how this evolves. And I think proof's going to be in the pudding, just patients choosing to be part of these programs, be part of these, health plans that have quality, as opposed to saying, I'm good with the way things are in my experience right now in the healthcare system.
So this is really interesting because, again, the healthcare is a unique industry. I think anyone that has even dipped their toe into healthcare knows that. It feels very much like the data's there. We have all sorts of clever ways to analyze the data and get better insights. Feels like a lot of the barriers are just getting the right data in the hands of the right people and then developing the trust, especially when it comes to your health and it comes to your family's health. That's not something you feel good about innovating. It's like, well, I'm going to try this new flavor of ice cream today and see if I like it. Is that generally the feel in industry?
Well, I mean, it really depends. And I think that to this point, the folks who work in the industry also have to experience the industry. And so, I joke with folks that sometimes there's a desire to fix it because someone, experiences, hey, what it's like to wait, explain something 5 times to, someone on the phone and the insurance company, the provider, what's going on. I think as well that I mentioned the term consumerism earlier on. Consumerism right now in healthcare is the idea that the system is not really set up to be patient oriented. And if you take some of those barriers, some of that friction away, a patient, for example, who has diabetes is more likely to adhere to their treatment plan with their doctor to seek care when they need it, as opposed to being more expensive down the road, going to the emergency room or having a complicated incident related to something else. And so that is a big shift for the industry. It's of course not going to happen overnight, but certainly there are a lot of opportunities there. And in some cases, the patient may not even realize it's going on. It's happening in the background. They may go into their provider's office. They're having a conversation about better managing, let's say, their high blood pressure and cholesterol that could go into diabetes. And the provider may have all their information on their electronic health record, including their health plan, right in front of them, so they can prescribe, hey, your insurance company is going to cover this, or maybe I need to do a prior authorization. I can just do that with the click of the button to make it way easier for the consumer once they go to the pharmacy to get that drug, as opposed to finding out there, hey, this drug is going to cost a lot of money, or the insurance company doesn't cover it. I have to call the doctor back. They have to call the pharmacist and the insurance company. And so we know that creating that easier experience is more like we're going to see adherence for to manage a lot of these conditions, which will help with everything I was mentioning, value-based care. And of course, we're going to see it in the data when we find these opportunities, when we evaluate it, and really discover what else can we do to move the total cost of care. And of course, I'm just talking about the commercial market itself in this specific example.
So I know that I actually want to talk more about consumerism, because I think there's some very interesting differences between healthcare and buying on Amazon. But I want to get to those. But before I do, with what you talked about, that there's these different systems that need to talk to each other, that need to trust each other. Information needs to pass through. Did you see in your time in the industry, is that innovation happening at the clinician level, at the hospital level, at the insurance level, at the government level, just kind of broad initiatives at academic level? Where is that drive, and where's the innovation around that coming from?
Yeah, well, of course, I can't comment on the government here, but I would say for sure we do see that as a broader initiative happening. It definitely is very regional to regional, provider to provider, as well as insurance company to insurance company. I mean, one of the key initiatives related to that in specific is that if you call, one of the things the insurance companies are moving towards in particular is if you call the insurance company, having all that data, that full picture of that patient right there, so that customer service rep can answer the question the first time, as opposed to bouncing you to this, this person, that person, this person. It's still kind of a slow slog, and anyone can try calling their insurance company right now and seeing if that's the case. But that's certainly, the data sharing, of course, does still remain a bit of a challenge. For all payers and providers in the insurance business, as well as one of the lesser talked about items in that regard that's getting a little weedsy is there's such a thing as too much data, right? And being able to have so much that's inundating you, as opposed to what's really matters here to impact this patient. What are they going to respond to? Is this patient, for example, who's been smoking for many years, but they're having knee pain, are they ready to have that conversation about smoking cessation, or are they just calling and want to talk about the knee surgery? How do you reach that patient where they need to be reached? So the short answer is that it really does depend. And that is something that certainly could be holding the industry back right now, to be able to share these data analytic insights. I believe the term is interoperability between providers and insurance.
That's interesting. Even just you saying that, it starts making me think of some of the challenges of people analytics, of how do you think about your employees, their long-term progression inside your company, what interventions are necessary. But again, I am now in the weeds. Going back to consumerism, and I actually think you might have just hit on my question. There's definitely a difference that, when I go to Amazon, it's not only here's what you're buying, but here's these other things that Jeremy would probably like to buy, and normally they're right. Like, there's such a hyper-specific targeting inside the world of retail that does not exist in healthcare. I don't hop online and suddenly say, "Hello, you're a 46-year-old bald man. I think that this is what here's a doctor in your area." Are we seeing it move towards that, or is it kind of the data, just the lack of being able to pass healthcare data will make that so it's, or maybe we don't even want that? We'll never have kind of a one-to-one with some of the consumerism in the retail side of things.
Yeah, well, I think from a broad sense, healthcare has a lot of other requirements to keep that data private, right? It's not as easy as, hey, I have a cookie, on Amazon for buying cookies, we'll say, for lack of better words. What other cookies would I want to buy, or what sort of electronics would I want to buy? It is a little more complicated than that. What we do see, though, is that, there's been a lot of consolidation in the past few decades for healthcare. And recently the consolidation has been focused on trying to manage that member's experience. And so if, for example, they went to a televisit, right, we'll use the example of the flu, and, maybe they didn't actually have the flu, or they talked to the doctor, you could see examples where they would recommend, hey, when you go to this store, here's how much this medication costs, have that live data right there. But yes, I mean, depending on where you are, certain parts, it still is very fragmented. And certainly the goal is to be able to, again, take that friction out of the system, because that we know that's going to mean that more patients are likely to adhere to that treatment if they have less barriers that were historically just put up due to, how the industry developed.
So you might have already touched on these, and if so, I have other questions, but other broad trends that you've been observing over the last 10 years, anything else kind of jumping out that you're seeing as a trend that the model of healthcare is shifting, especially the data informed side of it?
Yeah, I think the past few years, in particular, there are a few data specific trends we could talk about. One, when you go to your doctor's office, we're starting to see less of clipboards and paper, right? And makes a big difference. I say this as someone who, as friends know, I don't have the best handwriting, and so doctors trying to read my handwriting could be a bit of a challenge to providing me care. And of course, if a doctor is looking at that clipboard live, they're kind of missing any analytics or the opportunity to prescribe a different drug that could be, could come out in an electronic health record system. I think as well, what we're also seeing, in addition to trying to make that patient experience as seamless as possible, is we're seeing a big discussion around price transparency and how data can help with that. In particular, I talked about one definition of consumerism earlier on, but about 15 years ago in the mid 2000s, a little more than that actually, we saw high deductible health plans rise in popularity amongst employers. And again, that's asking consumers to have a little more skin in the game with the conjunction of health saving accounts. Well, in certain cases, the consumer was able to have an impact on certain costs. Again, the theory being, hey, if they have to pay more out of pocket, they're going to eat healthier, they're going to exercise, they're going to choose least costly services. However, in a lot of cases, prices in healthcare are still kind of a mystery to the consumer. Sometimes it's not the first thing everyone thinks of when they need to get an x-ray, for example. And so to help bring the healthcare to the next stage, there has been an industry trend to improve price transparency for services. And I could bore you with a ton of stories on on my own personal experiences with that, but that certainly, I think remains a challenge that data can play a big role in to help the consumer make a more informed choice. Again, it's hard to do that if you just don't have the information in front of you, right?
It feels like there almost has to be a first mover there. Does it feel a lot of times, in the healthcare system with the multiple stakeholders, that's one of the difficulties in making a move like this is, well, who moves first? Do the doctors just start giving out prices? Do patients just start asking for prices? Do insurance companies? Does it have a little bit of that feel to it?
Yes and no. I mean, the challenge with healthcare as well is that, there are only a certain number of services that the consumer can have skin in the game in, depending on their health plan. For example, that knee surgery, but odds are, let's say you have a $2,000 deductible, which, about 40% of those folks who are in a small business do have a high deductible health plan of that amount if they're an individual. You're probably not going to mind as much because that knee surgery is likely going to cost more than $2,000, right? So it does really depend on the condition, on the availability. And so probably more folks who are entering the market are a little more forward on that. But, again, we talked about the data. The providers were never, and insurance companies were never asked to use the data for value-based care until recently. That hasn't really been a conversation for, being able to publicly post that data. And in large part because, consumers were never asking for it because they never had to pay, and employers, it just wasn't their major consideration when they were offering health benefits. So it's a fluid industry. I wish I could say that there were certain folks who were advancing more than others, but I think it really just depends on, how different companies are approaching their value proposition to consumers.
That actually makes perfect sense. I'm not going to ask you the unfair 1 minute left question. 20 years from now, what would you hope the healthcare system looks like in the U.S.?
Well, I hope for starters. We're no time for the question.
No. I said especially as it relates around data.
Sure, yeah. So I hope in 20 years, I don't need a knee surgery. That's just for starters. I'm statistically speaking, I may. I think that in the next 20 years in particular, we're going to really see which one of these data solutions work and which ones are falling short. We're also going to see some of these longer term solutions, how they are actually working. Certain interventions, for example, if I was coming with high cholesterol tomorrow, there's certain interventions they would make that we may not see pay off for many years now. The other thing I think we're going to see, and I think this is where some skeptics may not understand, data skeptics may not, fall short, and some folks who are very data forward may fall short, is that healthcare is going to remain human, or should remain human. We're still going to need nurses to insert shots. We're still going to need doctors to perform surgeries. They may have better tools to make that surgery better, as well as we're still going to need that bedside manner that doctors and nurses are so famous for. And so that's what I hope or predict is going to happen in the next 20 years. And I look forward to seeing it.
So, David, thank you so much for being here today. To say we just hit the tip of the iceberg would probably be an understatement, but we are unfortunately out of time. So for everyone watching, please follow Fuqua on LinkedIn to stay in the loop about these analytics conversations, and also our series featuring faculty members and insights from their research.